Hello everyone. A very good morning to all of you. Am I visible? Am I audible? Let me confirm if I'm clearly visible, audible in the next few seconds. If I'm clearly visible, audible, then I will start the class ahead. Okay? Yes, I hope it's working. So I welcome you all for today's session. Very good morning to all of you. I am Dr. Priyanka Sachdev here, and today I'm here to continue my series of super simplified pathology. So in this series, I'm going to teach you entire pathology. I have started with systemic pathology. System by system, we will cover entire pathology in a super simplified way. So yesterday, I guess we have started renal system. In the renal system, we have started the various types of glomerulonephritis. Those who have attended my yesterday's lecture, they know that in yesterday's lecture, we have covered the primary glomerulonephritis in a beautiful, easy, comparative way. We have made the tables comparing various types of primary glomerulonephritis. Now, in this session, first, I will continue with the secondary and hereditary glomerulonephritis. So, glomerulonephritis will be over. After the glomerulonephritis, then we will continue with the tubular disease, that is ATN. We will continue after tubular disease, we will continue with vascular disease, that is hypertensive nephropathy, and we will continue with some interstitial diseases, that is pyelonephritis. We will continue with obstructive uropathy, that is calculi in the urinary tract. And after that, in the end, we will continue with renal tumors, adult renal tumors, pediatric renal tumors. Not only this, the last session will be a special image-based and clinical question-oriented session based on complete renal system. So renal system is the major system in all syllabus. Now, whether you are a second prof student and you are preparing for your second prof university exams of pathology, whether you are a final prof student and you are preparing for your medicine exams, the university exams in which renal system is also a part, or whether you are an intern and you are preparing for any of your competitive exam, maybe NEET PG, the next year, maybe INICT, FMG, whatever. Renal system is such a system, you always have to understand the concepts behind that. So it is important for university exams also, and it is very important for competitive exams also. You know, many questions come from this system. Nowadays, many image-based questions. So renal system is a vital area from which many image-based questions can be considered. Anyways, without wasting any further time, let me continue with renal system. I guess yesterday I have taken glomerulonephritis. So in the first 5 minutes of this session, again, I will give you the orientation of the structure of the glomerulus, the filtration barrier that we have already discussed yesterday, so that you have a better understanding of secondary glomerulonephritis. In this session, I am not continuing with primary. The primary are over. The 9 type of primary, yesterday I have discussed. All the sessions are available on YouTube. Those who have missed the live sessions yesterday and not watched the recordings yet, please I request them to watch the recordings once after the session. After secondary, I will continue with hereditary glomerulonephritis. So let me tell you what is glomerulus, because we are studying glomerulonephritis. Glomerulonephritis is itis. Itis is the inflammation of that structure. Glomerulonephritis is the inflammation of the glomerulus, right? So you can see this is a nephron. In the nephron, you can see the 5 parts. So this portion of the nephron is known as glomerulus. Of course, we all know this is proximal convoluted tubule, this is loop of Henle, this is distal convoluted tubule, this is collecting duct. We can notice the corresponding portions of the nephron. But currently, I'm not interested in all these tubules. I am interested in glomerulus, right? So in the glomerulus, I can see there is an afferent arteriole coming inside the Bowman's capsule. You can see this is the Bowman's capsule. Afferent arteriole coming inside the Bowman's capsule, forming multiple tuft of capillary and leaving out as efferent arteriole. So this is glomerulus, right? So let me zoom out. Can you see inside? Okay, let me draw the structure for you. Let me draw a Bowman's capsule. This is the Bowman's capsule. Can you see? It is continuing with PCT. You can see this is Bowman's capsule. Now let me draw the afferent arteriole. It is coming inside. This is the afferent arteriole coming inside and forming a tuft of capillary and leaving out as efferent arteriole. Right? This is the afferent arteriole forming a tuft of capillary and leaving out as efferent arteriole. You all can see, I'm saying this is afferent arteriole. I'm saying this is forming a capillary and leaving out as efferent arteriole. You got my point. Now, whatever blood is coming in afferent arteriole, here the blood is coming. Whatever blood is coming in the afferent arteriole, it contains substances. So the excretory substances or metabolic waste is present in the blood. Now, whatever substance, it can be creatinine, it can be urea, it can be BUN, whatever metabolic waste, the substance that want to get excreted in urine, that has to cross that has to cross this barrier and get accumulated here in the Bowman space, right? And after that, it will be excreted from the nephron in the urine. You got my point? So whatever substances present here in the blood capillary that has to cross a barrier. So this is known as filtration barrier. This is known as glomerular filtrate, and this is known as glomerular filtration barrier. So what is the lining? What is the lining? So you can see there are 3 layers that this substance has to cross. These substances which are present in the blood for coming in the urine, they have to cross 3 layers in between. What are the 3 layers? The first layer is the basement membrane of the capillary. This is the basement membrane of the capillary I am marking. All the capillaries or the blood vessels have a basement membrane. So this is the basement membrane of the capillary present here, right? After that, on inner side of the capillary, the lining is endothelial cell. This is the lining, endothelial cell. So this is the capillary with a basement membrane and endothelial cell. And see the lining of the Bowman's capsule. Can you see a Bowman's capsule? In the Bowman's capsule, 2 type of lining is present. So this lining which I am drawing right now, this lining is visceral epithelium, and this lining which I am drawing now. Can you see this lining which I am drawing now? This one is parietal epithelium. So you can see which epithelium is coming in the filtration barrier when the substances are crossing. When the substances, this is the substance, it is an excretory substance. It is crossing the blood and coming in the urine. So while crossing, 3 things have to be crossed. Number 1, the endothelium of the capillary, which is coming in the way, right? Number 2, basement membrane of the capillary, which is coming in the way. And number 3, visceral epithelium of the Bowman's capsule, which is coming in the way. Parietal is not coming. Ultimately, the substance will come in the Bowman space. So what are the 3 structures? These 3 structures constitute a barrier known as filtration barrier. Everyone give me a thumbs up. You got my point? So innermost is endothelium of the capillary, middle one is the basement membrane, and this side, it is the epithelium of the Bowman's capsule. So can I say basement membrane is in the center? On one side there is endothelium, on other side there is epithelium. Yes or no? So this is known as filtration barrier. This epithelium is the visceral epithelium. This epithelium is the visceral epithelium of the Bowman's capsule, and it is known as podocyte because of its shape. Everyone give me a thumbs up. So Sufi, Fast Medico, have you got it? Am I visible? Am I audible? Are you people there? So this is filtration barrier. In this diagram, I have shown you the capillary. The afferent arteriole is coming, forming a capillary and leaving as efferent arteriole. So you can see capillary have 2 things, basement membrane and the lining is endothelial cell, right? Now in this diagram, I have shown the same diagram which I have drawn for you. So you can see the capillary is lined by the basement membrane. Can you see? This is the capillary lined by the basement membrane. The inner side of the basement membrane is the endothelial cells of the capillary. Yes, this is the inner side which is endothelial cell of the capillary. The outer side of the basement membrane. Can you see the outer side? No, this is the basement membrane, the capillary basement membrane. On one side we have endothelium of the capillary, this is. And on other side you can see these green color cells. This is epithelium. Epithelium, which epithelium? Visceral epithelium of the Bowman's capsule, which is the shape of the podocyte. So these 3 substances, these 3 membranes have to be crossed. That is basement membrane in the center, endothelium on one side, epithelium on other side. This is known as filtration barrier. So if you know now, the filtration barrier includes 3 things. Endothelium on one side, epithelium on other side, and in the center basement membrane. This is known as filtration barrier. So I guess this is filtration barrier, and you all got it. What is filtration barrier? The same diagram. You can see in the center, this is basement membrane. You can see on one side, there is endothelium. This is endothelium of the capillary. On any side, you can draw anything. And on other side, it is the visceral epithelium. The visceral epithelium of the Bowman's capsule. The visceral epithelium of the Bowman's capsule is known as podocyte. Podo का मतलब होता है foot, human foot. See the shape of the cell. The shape of the cell is looking like a human foot. You know what is the shape of human foot? It's like this. So the cell is also like this. You can see the shape of the cell. This cell. That's why the cell is known as podocyte, because of its shape. So I am done with the filtration barrier. Now you all understand this diagram. If I am cutting the glomerulus from here, and looking from above. Now there is not one capillary. Here I have drawn only one capillary, but there are multiple capillaries. Afferent arteriole is coming, forming multiple capillaries inside the Bowman's capsule and leaving out as efferent arteriole. So if I cut and look from above, so this is the diagram. This is the master diagram in which we are going to discuss today also glomerulonephritis. Yesterday also we have discussed all glomerulonephritis in this diagram only. So here I am cutting the Bowman's capsule and looking from above. So how many capillaries I can see? I can see multiple capillaries. I can see 1, 2, 3, 4. I can see 4 luminated structures. All of them are capillaries. Now in each capillary, try to see the filtration barrier, the triplet, the triad. Can you see the inner side of all capillaries, the orange colored lining, which is fenestrated? I'm drawing. This is fenestrated. This is endothelium. This is endothelium. In all capillaries it is present. Here it is like this. Here it is like this. This is endothelium. So inner side of all capillaries is endothelium, right? So here this is the endothelium. Now here I am drawing the basement membrane of all capillaries. So the circles which I have drawn, that is the basement membrane of all capillaries. And the outer side of the basement membrane. On the outer side of the basement membrane, can you appreciate these cells? These cells, these are podocytes. These are the podocytes. That is visceral epithelium. So you can appreciate the triad, right? In all the capillaries, right? Can anyone tell me what are these yellow color cells lining out? The yellow color cells. So this cell, this cell. Can anyone of you tell me? Fast Medico, Sufi, anyone other who is watching me live, what are these yellow cells? The yellow cells are the Bowman's capsule lining, but the parietal one. I told you, in the Bowman's capsule, two lining are there. Can you see this green lining? This one. This is the visceral. It is in the triad when the substance crosses from the blood to the urine. But can you see this lining? This one. This is the outer lining of the Bowman's capsule covering everything. So this one is the parietal one. So here the parietal is this one. The yellow cells are the parietal, covering everything, right? Apart from it, can you see the green cells? Green cells. What are these green cells? What are, yes, Sufi, absolutely right. What are these green cells, Sufi? The green cells here are the mesangial cells. Mesangial cells are the supporting cell. As I have told you, this is the parietal Bowman's capsule, inside which multiple capillaries are present. These are the multiple capillaries. So this is the basement membrane I have drawn. The inner side is the endothelium in all of them. Let me draw few endothelium in all of them. The inner side of the basement membrane. The red is the basement membrane. The purple is the endothelium. And now I am drawing the epithelium, the visceral epithelium. So the green is the visceral epithelium, the podocyte in all of them. So I guess the same diagram which was drawn in Robbins, I am simplifying for you. Can you see? So I have drawn multiple capillaries. See the color coding. You can use any color. So with the red color, I have shown you the basement membrane in all of them. The red is the basement membrane of the capillary. With the purple color, I have shown you the inner side, the endothelial cell. And with the green color, outer side is the visceral epithelial cells. And these are the parietal epithelial cells which are covering from out. So these are the parietal epithelial cells. You got it? Now, can you see the space between multiple capillaries? The space between multiple capillaries is filled by the filler cells. Supportive cells. These are the mesangial cells. So this is the complete structure of a glomerulus. If you have understood it, we can start the glomerulonephritis. Yesterday we have already started glomerulonephritis. Let's see the first classification of glomerulonephritis. Glomerulonephritis are of three types. Primary glomerulonephritis, which includes 9 types. Secondary glomerulonephritis, there are many, but I will teach you 3-4 which are important, right? And the hereditary glomerulonephritis, which are 4 in number. So yesterday we have completed primary. Now today I'm directly starting from secondary and then continue with hereditary, right? Give me a thumbs up. This is a list of primary glomerulonephritis, which are 9 in number. What is the difference between primary, secondary and hereditary? In primary glomerulonephritis, basically the disease is involving the glomerulus. The primary disease is of glomerulus. In secondary glomerulonephritis, the main disease is something else. It can be diabetes, it can be SLE, it can be anything else. But glomerulus is involved secondarily, not as a main disease. And in hereditary, it is hereditary in nature. So there is some mutation and it is hereditary congenital in nature. So these are the 3 type of broad classification of glomerulonephritis. The primary one are 9 in number. You have to learn the name of the 9. So this is PSGN, post-streptococcal glomerulonephritis, RPGN, rapidly progressive glomerulonephritis, minimal change disease, MCD, membranous glomerulonephritis, membranoproliferative glomerulonephritis. So MGN, MPGN. Then the 2 are focal segmental. This is also focal segmental. This is also focal segmental. But one is glomerulonephritis, one is glomerulosclerosis. Yesterday we have seen the differences between these two, right? IgA nephropathy, and the last one is chronic glomerulonephritis. Count, they are 9 in number. So yesterday I have asked, these are the 9 primary. Yesterday I asked you to make a comparative table between these 9 type of primary, and I have filled this table for you. So those who have missed my last 3 lectures, episode 1, 2, 3 of renal pathology, you are doing a big mistake. Please watch the recording on YouTube, in which I have covered this table. I am not covering it again. So I have taken the 9 type, 1, 2, 3, 4, 5, 6, 7, 8, 9. The 9 type of primary glomerulonephritis under these headings. what is the etiopathogenesis of each of them, whether it is antigen antibody mediated, whether it is cell mediated injury, or whether it is alternate pathway or complement mediated injury. If it is antigen antibody mediated, where is the complex formed? The complex is formed in circulation or where it is formed in C2. If it is formed in C2, then is the antigen is fixed or planted? I have explained you everything in the etiology. In the gross, only few gross are important. I told you that. I told you 3 microscopy yesterday. Of each glomerulonephritis, you have to state 3 microscopy. Light microscopy, electron microscopy, immunofluorescence. In light microscopy, you have to tell HNE features of that particular glomerulonephritis. In electron microscopy, you have to tell the location of the antigen antibody complexes, that is deposits. Deposits का location क्या है? And in immunofluorescence, you have to tell the composition of deposit. Deposition बना क्या का है? So these are the 3 microscopies you always have to state while saying any glomerulonephritis. After that, one more column we have created, clinical features, in which I always used to tell you which glomerulonephritis present as nephritic syndrome and which glomerulonephritis present as nephrotic. So among this list, you must know कि इनमें से nephritic वाले कौन से हैं, nephrotic वाले कौन से हैं, both वाले कौन से हैं. It is always important to know nephritic and nephrotic syndrome, which of the glomerulonephritis present as what. Because nowadays in the clinical questions, you will get a clinical question, a big clinical history. So patient presents with proteinuria, mild proteinuria, severe proteinuria, edema, hematuria. So looking at the symptoms, you must be able to identify from the clinical history given to you that whether the patient is having nephritic syndrome or nephrotic syndrome. That is the first challenge in your question. जो question आएगा ना exam में, it will be like a big clinical question. So reading the question, you must be able to find कि पहले nephritic है कि nephrotic है. Yesterday I taught you what is nephritic, what is nephrotic. If the patient is having blood in urine, it is always nephritic. Hematuria is nephritic. But if the patient have heavy proteinuria, it is always nephrotic, right? So I have told all these topics, explained all these topics, just a second, in detail yesterday. I guess you must watch the recording if you have missed it, right? So after coming to that point, that from the clinical question, whether the glomerulonephritis is nephritic or nephrotic, so it narrows your horizon. So from all these, which of them are nephritic? From all these, which of them are nephrotic? You must be knowing that also, right? So we have completed it. I'm not going in detail again. We have already done primary yesterday. Now it's time to start secondary. It's time to start secondary glomerulonephritis in this session. That was an overview of yesterday's session. Now I'm starting the secondary. In the secondary, there are many, but I cannot teach you all. I will teach you only the important one. So I will teach you diabetic nephropathy, in which the main disease is diabetes and kidney is involved secondarily. I will teach you lupus nephritis, in which main disease is SLE, but kidney is involved secondarily. So basically, I am going to teach you these two here, which are the most important in secondary glomerular diseases. Everyone give me a thumbs up. This is secondary. After the secondary, I will teach you hereditary also. So let me first finish these two. First, I will finish diabetic nephropathy. Then I will finish lupus nephritis. So all the primary are done. From the secondary, important one are done. Then we will come on the hereditary. In the hereditary, I am going to teach you 4. What are the 4 hereditary? There are 4 only. 4 nephritis, glomerulonephritis, which are hereditary in nature. The most important is Alport. Alport पे बहुत questions आते हैं. You get many questions on Alport. Alport glomerulonephritis or Alport syndrome, Fabry disease, second one, Nail patella syndrome, third one, and at the 4th one, thin membrane disease. Thin membrane disease. So I will explain you all 4 hereditary also. Let me start with secondary. You got the overview. Shall I start the secondary? So in the secondary, I will teach you 2 diseases. So involvement of glomerulonephritis in diabetes mellitus and involvement of glomerulonephritis or kidney in SLE, right? So this one is known as diabetic nephropathy. This one is known as lupus nephritis. Let me start with diabetic nephropathy. Only these two I'm going to teach you detail in secondary one because they are only important, right? So I'm starting with the diabetic nephropathy. As I have told you, what is diabetic nephropathy? Diabetic nephropathy is the renal involvement in diabetes mellitus. We know what is diabetes mellitus. Diabetes mellitus is a disease. It is a metabolic syndrome in which patient presents with one thing. The one thing is hyperglycemia. Hyperglycemia. Patient have high glucose level in the blood. We all know that what is diabetes. And we know diabetes are of 2 types, type 1 and type 2. Type 1 is from the childhood. Type 2 occurs in old age after 40s or 50s. That is maturity onset, right? So the 2 type of diabetes are there, and ultimately whether it is type 1 or type 2, the problem is that in both type 1, type 2, in all diabetes, the problem is that patients have high glucose level in the blood. Patients have hyperglycemia. That is the metabolic condition known as diabetes mellitus. Now, what is the problem? If my blood contains glucose, say as 80 milligram, or it contains 200 milligram, or it contains 400 milligram, how does it matter to me? Does it matter to me? Yes, it must. Is it fixed? Let me confirm if I'm visible or audible. I will start the class ahead. Give me a minute. Yes. I guess it's working now. I guess it's working. Okay. So I guess I should continue. So I was teaching you the secondary glomerulonephritis. So in secondary glomerulonephritis, I was teaching you the first one, diabetic nephropathy, and the second we will take is lupus nephritis. We have started diabetes nephropathy, right? We have started diabetes nephropathy. So we know diabetes is a disease in which diabetes mellitus patient presents with hyperglycemia. Patient presents with hyperglycemia. So the high blood glucose level in the blood damages multiple organs. It damages multiple organs. Especially 3 organs in the diabetes are damaged. One is kidney, so it is known as diabetic nephropathy, which is my topic right now. The second is retina of the eye, which is known as diabetic retinopathy. That ophthalmology, the ophthalmology tutor may teach you. And the third is the neuropathy, in which the nerves are damaged. So diabetic nephropathy, diabetic retinopathy, and diabetic neuropathy. These are the 3 complications which occurs in diabetes. In type 1, in type 2, both of them, whenever there is hyperglycemia in the blood, the increased blood glucose level causes damage to 3 organs. But currently I am teaching you renal system. So here I will teach you only diabetic nephropathy. You give me a minute. I want to change the color of the pen. For that, I have to go on the desktop. Give me just a minute. It will hardly take 1 second. Okay, just a second. Yeah, I guess I am done. Yes. So, yeah. So, diabetic nephropathy. Now, let me start the diabetic nephropathy. Right. In the diabetic nephropathy, I will teach you 3 things. So, in the structure of the nephron, whenever the blood glucose level is high, that is hyperglycemia is there, that is diabetes mellitus, then glomerulus get affected. Glomerulus of the nephron get affected. In the glomerulus, there is no glomerulonephritis. It is glomerulosclerosis. The blood vessels in the nephron are also affected, and the tubules in the nephron are also affected. You know the diagram of a nephron. In the nephron, we have a Bowman's capsule. After Bowman's capsule, we have PCT, loop of Henle, DCT, and collecting duct. So in diabetes, which portion? And this is afferent arteriole. This is loop of forming tuft of capillary, and this is efferent arteriole. Right. Now in diabetes, which portion of the nephron is affected? I'm saying that in diabetes, the first portion affected is the glomerulus. So in the diabetes, there is glomerulosclerosis. It is not glomerulonephritis. It is glomerulosclerosis. The second portion which is affected in diabetes is the tubules. All these tubules, PCT, loop of Henle, DCT, collecting duct, tubules are also affected in diabetes. Right? What will happen in tubules? I will tell you. Right? And the third thing, the blood vessels, the afferent and efferent arteriole. Right? These blood vessels are also affected in diabetes. So in the diabetes, I will teach you 3 things in the nephron. In the nephron, the 3 things are affected. So in the kidney, in the diabetic nephropathy, there are 3 things. One is glomerulus, that is glomerulosclerosis will occur, then vascular lesion, then tubular lesion. Let me start with glomerulus. Glomerulus is affected by 2 ways, the diffuse glomerulosclerosis and nodular glomerulosclerosis. So in diabetes mellitus, whether it is type 1 or type 2, glomerulus mein glomerulonephritis do not occur. In the glomerulus, glomerulosclerosis will occur. What do you mean by glomerulosclerosis? I will tell you. There are 2 types of glomerulosclerosis. One is diffuse and one is nodular. So basically you will ask me, ma'am, what is glomerulosclerosis? In glomerulosclerosis, inside the glomerulus, hyaline will get deposited. Hyaline deposition is glomerulosclerosis. What is hyaline? You should ask me, ma'am, what is hyaline? What is hyaline? Hyaline is a pink color, eosinophilic, structureless, acellular, homogeneous mass. Tell me the definition of hyaline. It is pink color. Pink color means eosinophilic. It is acellular, structureless, homogeneous pink color mass, and that get deposited inside the glomerulus. So the glomerulus is said to be glomerulosclerosis is occurred. Whenever hyaline get deposited inside glomerulus, glomerulosclerosis is there. Right. Now what is the location of hyaline deposition? Hyaline is depositing where? Depending on that, it is of 2 types, diffuse and nodular. Okay, you will understand once I will show you the diagram. So I am teaching you diabetic glomerulosclerosis. I have explained you that in diabetes, glomerulonephritis do not occur. You know the meaning of glomerulonephritis and glomerulosclerosis. What is the difference? In glomerulonephritis, proliferation of the cell takes place. Here, cell proliferation is not taking place. In glomerulosclerosis, hyaline get deposited inside the glomerulus. So, let me teach you the two forms, the diffuse and the nodular, right? Diffuse form, start with diffuse form. Diffuse form is more common. It is more common. It is known as diffuse because it affects all parts of the glomeruli. See this diagram. Can you see this diagram? In this diagram, can you appreciate one glomerulus? Where is the glomerulus? So this is one glomerulus. Only one glomerulus is shown in this diagram. I guess only one is there, right? You all can see this glomerulus. First, everyone give me a thumbs up. Can you see this glomerulus? Now, inside this glomerulus, please everyone appreciate hyaline is deposited at 4 places. You can understand the normal diagram now. Now, hyaline is deposited at 4 places. Number 1, it get deposited in the capillary basement membrane. Can you see all the capillaries have thickened basement membrane? If you zoom and see the basement membrane lining, it is thickened. So basement membrane of all the capillaries thickened because of deposition of hyaline in the basement membrane of the capillary. So all the capillaries, basement membrane hyaline get deposited. Number 1. Number 2, it is deposited in the mesangium. Mesangium. You know, mesangial matrix and mesangial cells, the space between the capillaries. So number 1, it is deposited in the basement membrane, causing thickening of the basement membrane. Number 2, it get deposited in the mesangial matrix. Mesangial matrix. Number 3, it is deposited in the capillary wall. Can you see the wall of the capillary? See all the capillaries. In all the capillaries, see the wall. The few capillaries, can you see this cap-like structure? Topi jasa, capped. You know, cap-like structure in the wall of the. ऐसा लग रहा है capillary ने cap लगाया है. Can you see this capillary also have a cap? This is the wall of the capillary having hyaline deposit. See this capillary. It is also having a cap. So this cap is known as fibrin cap. So hyaline get deposited in the wall of the capillary. The third thing. And the last one, it is deposited in Bowman's capsule. Can you see this is Bowman's capsule, this pink color material in the Bowman's capsule. Here also in Bowman's capsule, this pink color material. So this is known as capsular drop. So hyaline is deposited at 4 places. That's why it is known as diffuse. Everyone give me a thumbs up. Diffuse ka matlab hyaline is deposited at 4 places. So what are the 4 places? Hyaline is deposited. Hyaline is deposited inside the glomerulus at 4 places. What are the 4 places? First of all, it get deposited in glomerular basement membrane, causing the thickening of the basement membrane. So this is the earliest feature. Ispe MCQ aata hai, which is the earliest. So earliest is this one. Second, it deposited in the mesangium. Third, it get deposited in the wall of the capillary wall in the form of a cap known as fibrin cap. In the form of the cap known as fibrin cap, right? Cap yani topi, right? And fourthly, it is deposited in Bowman's capsule. It is known as capsular drop. It is known as capsular drop. In the Bowman's capsule, various deposits are there. Hyaline is deposited at 4 places. That's why it is known as diffuse. Diffuse glomerulosclerosis, because deposition of hyaline is sclerosis. It is causing sclerosis. Everyone give me a thumbs up. Can you understand the diagram? Can you understand the diagram? In diffuse glomerulosclerosis, the hyaline is deposited at 4 places. Number 1, GBM, which is the earliest one, causing thickening of GBM. That is basement membrane, diffuse glomerular basement membrane of the capillary. Number 2, it deposited in the mesangium, causing increase in the mesangial matrix. Right. Number 3, it deposited in the Bowman's capsule. Parietal layer of Bowman's capsule, to be specific. Parietal layer of Bowman's capsule. And number 4, it is deposited in the wall of the capillary in the form of the cap known as fibrin cap. Everyone give me a thumbs up. These are the 4 places at which it is depositing. Number 2, now coming on the nodular one. In the nodule, it will not deposit it at 4 places. It will deposit it at only 1 place. Right. Nodular one is more specific. Diffuse one is more common. Nodular one is more specific. Now see the diagram. This is the diagram of nodular one. In the nodular one, again I can see one glomerulus in this diagram. So see, this is the one glomerulus in this diagram I am drawing. This is the one glomerulus. Inside this one glomerulus, where is the hyaline? Isme bhi deposit to hyaline hi hoga, but not at 4 places. Hyaline is deposited in the mesangium only. Only in mesangium, not in the Bowman's capsule also, GBM also, in capillary wall also. No, only in mesangium and in the form of small nodules. It is not diffuse deposition everywhere in the mesangium. Mesangium may be concise nodules, circular oval nodules. Can you see? I can see 4 nodules here in the mesangium. So that's why it is known as nodular. Because here also hyaline, deposit to hyaline hi hoga. Lekin hyaline kahan deposit ho raha hai? So here nodular deposits of the hyaline in the mesangium, only mesangium. not anywhere else. That's why this one is known as nodular. Everyone give me a thumbs up. So which is more common? Diffuse is more common. But which is more specific? The nodular one is more specific. Nodular one को हमने दूसरा नाम दिया है. There is one more name given to nodular one. Nodular one is also known as KW kidney. That is Kimmelston-Wilson kidney. That is based on the scientist or the person who have discovered it. So it's very very important. इसमें बहुत MCQ आते हैं. Kimmelston-Wilson kidney. So दिखने में the name of the disease is very catchy. You know. So what is Kimmelston-Wilson disease? KW kidney. So this one. This one. It is nodular glomerulosclerosis seen in diabetes mellitus. So that is KW kidney. You got my point? What is happening here? Here, oval or spherical laminated circles of hyaline is formed in the mesangium. So that's why these are past positive. These are past positive. That's why. Now compare the two. Everyone compare the two. Everyone. The two diagrams are in front of you. No one will teach you with such a simplicity. See, the two type of glomerulosclerosis seen in diabetes mellitus. Can you see? The two type of glomerulosclerosis seen in diabetes mellitus. In type 1 also, type 2 also, anything can happen. In both of them, they can occur. The first one is the diffuse and the second one is the nodular, right? In both of them, one thing is common. Since both of them are glomerulosclerosis, hyaline is deposited in both of them. Hyaline is deposited in both of them. But the point is that where is the hyaline deposited? In diffuse one, the hyaline is deposited at 4 places. What are the 4 places? Number 1, basement membrane of the capillary. So the capillary basement membrane will get thickened because of deposition of hyaline in the basement membrane of the capillary. You can see all the basement membrane are thickened here. Number 1. Number 2, it is deposited in the mesangial matrix. It is deposited in mesangial matrix, right? Number 2. Number 3, it is deposited in Bowman's capsule, the parietal layer. Can you see here? Parietal layer of the Bowman's capsule, and here also parietal layer of Bowman's capsule. Beautiful diagram, beautiful diagram. And the 4th one, it is in the wall of the capillary in the form of the cap. Cap का मतलब होता है टोपी, you know, cap. So it is looking, the capillary have worn a cap. Capillary ने cap लगाया है. This capillary, see this capillary also. This one, can you see the dark pink color? See, this capillary also have a cap, right? So these are the 4 places. That's why it is known as diffuse. So what are the 4 places? Learn the 4 places. So you have to say, ma'am, the first one is the GBM. The second one is the matrix, mesangial matrix. The third one is the Bowman's capsule, known as capsular drop. And 4th one is the cap in the capillary, that is fibrin cap. These are the 4 places. That's why known as diffuse. Coming on the nodular. On the contrary, see the nodular. In the nodular one, you can see the hyaline is deposited in the form of spherical, in the form of the spherical nodules. Can you see spherical or circular nodules are there? Spherical or circular nodules only in mesangial matrix, not anywhere else. So the hyaline is deposited only in mesangial matrix, that too not diffuse. यहाँ पे भी mesangial matrix में था, but it was not. It is diffuse everywhere in the mesangium. It is not concised in nodule. But on the contrary, यहाँ पे mesangium में है और it is concised in nodule. It is not diffuse. So that is the difference. Everyone give me a thumbs up. Everyone, everyone. So this is the difference. Now 2 questions I would like to ask here. Which is more common? Answer is diffuse. Which is more specific? Answer is nodular. Which is KW kidney? The another name given to nodular one is Kimmelston-Wilson kidney, KW kidney. Now you can imagine how many questions can be framed on this topic. It is diabetic nephrosclerosis. Everyone give me a thumbs up. Hello everyone. Am I back? Am I live? Can you confirm me? There is some technical error going on. I am unable to go live on OBS on YouTube. I guess I'm live. It's working right now. But if it happens again, if it's got stuck again, then I will continue the session on special class of Unacademy and I will get the problem resolved on OBS by today by the team, someone from the technical team. So let me continue and hope if it is not stucking again. So there is no problem in the internet or something on my side, but there is some problem on the OBS settings, I guess. I don't know why it is stopping and stucking again and again. I really don't know. Anyways, let me continue. But if it is stucking or stopping again, then I will continue on the special class after a few hours, the same topic. Anyways, so I was teaching you diabetes mellitus, then the renal complications of the diabetic mellitus, which is known as diabetic nephropathy. We have already seen the glomerular, how the glomerulus get affected in the diabetes. We have already seen there are 2 things, diffuse glomerulosclerosis and nodular glomerulosclerosis. Mind one thing, both of them are glomerulosclerosis, not glomerulonephritis. We have already seen that. We have already compared the diffuse and the nodular. Let me give this broad comparison again. This is the diffuse one and this is the nodular one. In both of them, hyaline is deposited. In diffuse one, the hyaline is deposited at 4 places. You already know. The one is the basement membrane of the capillaries. Number 2 is the mesangium, diffuse deposition in the mesangium. Number 3 in the Bowman's capsule. You can see the pink color deposits here in the Bowman's capsule. And number 4 in the form of the cap of the capillaries, the fibrin cap, the wall of the capillary. So that's why it is known as diffuse. But in nodular one, the hyaline is deposited only in the form of oval ovoid circles in the mesangium. In the mesangium, in the oval ovoid circles, nowhere else it is deposited. That's why it is known as nodular. Now this is about the glomerulus. We have already seen the glomerulus, the diffuse one and the nodular one. One more thing, diffuse one is more common, nodular one is more specific. So mind your MCQ. In the MCQ, more common form is asked, go with diffuse. If more specific or pathogmatic feature is asked, go with nodular, right? Go with nodular. The nodular one is given one more name. Can you tell me? Anu, Siddhika, Kishore, Sufi, what is the another name given to the nodular one? It is Kimmelsten-Wilson kidney. Very, very important. This is asked many times in your exams. Kimmelsten-Wilson kidney. Kimmelsten-Wilson kidney is the another name given to nodular one, not the diffuse one, right? So that is about the glomerular involvement in the diabetes. After glomerular involvement in the diabetes, I am coming on the vascular lesion. Blood vessels is also involved. In the diffuse one also, in the nodular one also, blood vessels are also involved. Now, I'm not interested in the glomerulus. I'm interested in the blood vessel. So, in this diagram, can you see a blood vessel? Yes, we all can see a blood vessel here, one blood vessel here, and one blood vessel here. So, in both the diagrams, one arteriole is shown. One blood vessel is shown. Now, we know all blood vessels have 3 layers: tunica intima, tunica media, and tunica externa. So in the tunica media, can you see pink color deposit in the media? Here, that is again hyaline. So hyaline get deposited in the media of the blood vessel here, and the same hyaline get deposited in the media of the blood vessel here. So blood vessel changes are same in both of them, and that is known as hyaline thickening of the arteriole. That is hyaline arteriosclerosis, which is a common feature in diffuse as well as nodular. So diffuse as well as nodular, the vascular features are common. And that is arteriolar arteriosclerosis, hyaline arteriosclerosis. That is hyaline. Hyaline is a pink color material. Pink color acellular structureless homogeneous material get deposited in the media of the blood vessel. In diffuse one also, in nodular one also. The disease is known as hyaline arteriosclerosis, which is a common feature of both. Can you appreciate? Now there are changes in the glomerulus here and here. The glomerular changes are there, but the arteriolar changes are same. Everyone give me a thumbs up. The third I am teaching you is the tubular lesions. The tubular lesions. Now I am not interested in the two diagrams. This is diffuse, this is nodular. I am not interested in glomerulus. I am not interested in blood vessels. I am interested in tubules. So where are the tubules? So in this diagram I can see one tubule here, one tubule here, one tubule here, and one here. In the second diagram again I can see this is the tubule. This is the tubule, this is the tubule, this is the tubule. By tubule, I mean PCT, loop of Henle, DCT, collecting duct, anything, right? See the cells of the tubules. In any of them, see the cells. If you can zoom, see the cells have vacuoles. They have vacuolated cells. The cell cytoplasm is having big vacuoles. Large vacuoles are present, right? This is due to excessive glycogen. The large vacuoles is due to extensive glycogen deposits appearing as vacuole. And this change is known as Armani-Ipston lesion, which is again common for both. So here also we can find the big vacuoles in all the tubules. Here also big vacuoles, and this is known as Armani-Ipston lesion, based on the name of the scientist who has discovered, nothing else. So Armani-Ipston lesions, right? So what is the summary? What is the summary? I would like to tell you the summary. You have to give me a minute again to change the color of the pen. My system is shutting off now, so again that software is going. I'm doing the settings again and again. Give me 1 minute only. Let me activate it. Yeah, so I can change the color pen now. Okay, so okay, now yeah, so it will be easy for you to use different colors to explain you some diagram. Now I can change the color of my pen. Anyways, now see, so in this diagram you can see, let me summarize. So this is the summary of diabetic nephropathy. In diabetic nephropathy, 3 structures in the kidney are involved. Number 1, glomerulus is involved. So in both of them, I can see one glomerulus here, one glomerulus here. Number 2, blood vessels are involved. So I can see one artery here, one artery here. Blood vessels, vascular changes. And number 3, tubules are involved. So I can see few tubules here, and I can see few tubules here, right? So let me tell you the changes in each of them. This one is diffuse glomerulosclerosis. This one is nodular glomerulosclerosis. Diffuse and nodular. These are the two types of glomerulosclerosis. which occur in a diabetic patient, right? Now let me start with glomerulus. If I talk about the glomerulus, the changes are different. In diffuse one, something else is there. In nodular one, something else. So different changes are there. In diffuse one, the one thing is common, hyaline get deposited in both of them. You should know the definition of hyaline. Actually, in diabetes, hyaline is deposited everywhere. Hyaline is a pink color, eosinophilic, structureless, acellular, homogeneous material. So in diffuse one, it deposited at 4 places. अब तक तो याद हो गया होगा कौन सी 4 places. In the basement membrane of the blood vessel, causing the thickening of the basement membrane. You all can see the basement membrane is thickened because of pink color deposition material. Number 2, mesangium. You can see it is deposited in mesangium. Number 3, it is deposited in Bowman's capsule, the parietal layer of the Bowman's capsule. Appreciate the pink color deposits here. And number 4, in the wall of the capillary in the form of the caps, the fibrin caps. In the wall of the capillary in the form of the caps, the fibrin caps. Since hyaline is deposited at 4 places, it is known as diffuse. It is known as diffuse. And so what are the 4 places? Let me mark the 4 places. The first one is GBM, that is glomerular base. It is the first, earliest. Second is mesangial deposit. Third one is Bowman's capsule, known as capsular drop. And the fourth one is the fibrin cap, the cap of a capillary fibrin cap. Now, in the nodular one, it is deposited only in the mesangium, not at 4 places. And in mesangium also, अब आप बोलोगे mesangium में तो यहाँ भी था ना मैम, but here the mesangium, it is diffuse everywhere in the mesangium. Here in the mesangium, it is in the form of the circles. Spherical ovoid circles are there. Spherical ovoid circles are there. So it is deposited only in mesangium matrix, that too in the form of the nodule. That's why nodular. So the diffuse one is known as diffuse क्योंकि यहाँ पे hyaline 4 जगह deposit हो रहा है. And nodular one is known as nodular because hyaline only in the form of the nodules in mesangium. Give me a thumbs up. So these are the glomerular changes in both of them. Which is more common? More common is diffuse one. Which is more specific? More specific is nodular one. Nodular one more name is given, Kimmelston-Wilson kidney. Coming on the vascular changes. Now in the vascular changes, you can appreciate one blood vessel here, one, but the change is common. In the media of the blood vessel, here also hyaline is deposited. In the media of the blood vessel, here also hyaline is deposited. So hyaline arteriosclerosis is a common feature of both of them. So here also hyaline thickening of the arteriole, here also hyaline thickening of the arteriole. There is no change in the blood vessel. The last thing which I must mention here is the tubular changes. So we can appreciate inside the tubules here, and we can appreciate inside the tubules here. In both of them, inside the tubules, large vacuoles are seen. Large vacuoles are seen, that is known as Armani-Ebston lesion. So it is not labeled here. So in both of them, Armani-Ebston lesion is there. So that is also common. So that is the summary. If you want to give final summary, so this is the, I guess everyone got it. So I am teaching you diabetes mellitus nephropathy, in which there are 2 types of diabetic glomerulosclerosis, the diffuse one and the nodular one. You must make this table, right? So in this table, along with drawing the diagram, you should tell me the changes in the glomerulus, the changes in the blood vessel, vascular changes, and the changes in tubule in each of them, here also and here also, right? You already know in the glomerulus, hyaline is deposited, here also hyaline is deposited. But here you know the 4 places, here you know only 1 place, that is mesangium. Vascular changes, here also hyaline deposited, here also hyaline deposited, that is hyaline arteriosclerosis, that is a common change in both of them. In the tubules, the vacuoles are present in the cytoplasm, here also vacuoles are present in cytoplasm because of extensive glycogen, and this change is known as Armani-Ebston lesion, right? So this is the summary. You already know this is more common, this is more specific, this is known as KW kidney. So this is the summary. We have super simplified it. So I am done with the diabetic. Now I would like to launch some questions based on this. Diabetic nephropathy. Diabetic nephropathy. In diabetes mellitus, the involvement of the kidney is diabetic nephropathy. So tell me the answer. Can you see the question in front of you? If you know the answer, please write down your answer in the chat box. Please everyone participate. So tell me the most common pathological feature in diabetes mellitus in the kidney. In the kidney, most common one. I am asking the most common pathological feature inside the kidney in diabetes mellitus. Is it papillary necrosis which take place? Is it diffuse glomerulosclerosis which take place? Is it renal arteriosclerosis which take place? Or is it chronic pyelonephritis which take place? So Sufi, you are absolutely right. What about others? Yes, Kishore, you are also absolutely right. It is the diffuse glomerulosclerosis. Diffuse glomerulosclerosis. Yes, very good. So correct answer here is B. Yes, Siddhika, absolutely right. Correct answer here is B. Right. This is the next question in front of you. Repeated many times in the previous year question papers and many exams. Kimmelston-Wilson kidney is seen in. I guess the question is super easy. Everyone will be right. Those who are watching me live, everyone will be right. Is it HIV nephropathy? Is it diabetic nephropathy? Is it SLE or is it malignant hypertension? Yes. So yes, you all are right. Sayantan, Siddhika, Sufi, Anu, very good. Is it diabetic nephropathy? Everyone knows that. And Zada better. The better what is the question if I give you the two types, the diffuse one and the nodular one. So the students will get confused and it is the nodular one. We know that it is the nodular one. Correct answer is B, right? Okay. Yeah, this is the next question I was asking for. Kimmelston-Wilson kidney, the lesions consist of. The lesions consist of, the four options are in front of you. So what does the lesions in Kimmelston-Wilson kidney? So is it splitting of the glomerular basement membrane? Is it the nodular sclerosis of the glomeruli? Is it hyaline sclerosis? Is it hyperplastic arteriosclerosis? Yes. So Sufi, Anu, Sayantan, absolutely right. It is the nodular sclerosis of the glomerular which is labeled as Kimmelston-Wilson kidney. Yes. So correct answer here is B. Very, very good. This is the next question in front of you. Pathological features seen in diabetic nephropathy. Now, I'm not saying whether diffuse or nodular. I'm considering both. Are all of the following except? Please mind except in the question. So here consider both because nothing is specific is mentioned. Consider diffuse also, nodular also because no specific name is mentioned. So see the four options and tell me one thing which is not present neither in diffuse one nor in nodular one. So let me read the four options. Fibrin cap and capsular drop. This one is present in diffuse, I guess. Intercapillary glomerulosclerosis. Intercapillary glomerulosclerosis. Right. Okay. This option. Focal intercapillary glomerulosclerosis will be seen. It is the glomerulosclerosis now. That is deposition of the hyaline. Right. That is seen. Basement membrane thickening is also seen in the diffuse one, I guess. So basement membrane get thickened because hyaline get deposited in the diffuse one. So this is also right. This is also right. By intercapillary glomerulosclerosis means, please understand the meaning. Glomerulosclerosis means hyaline deposition. Intercapillary यानी multiple capillaries के बीच में. Multiple capillaries के बीच में क्या होता है? Mesangium. So it is mesangial hyaline deposition. That too occurs in diffuse. Diffuse में होता है. But focal sclerosis do not occur here. So I will go with C. Yes, yes, mesangial Sufi. So split the term. If you are confused, just split the term to understand the meaning. Right? Focal sclerosis do not occur. Yes, Anu, absolutely right. So everyone is agreed with C? Yes. So C is the answer here. Okay. Okay. What you will say here? Type of nephropathy in diabetes. Two options are correct. Type of nephropathy in diabetes. Type of nephropathy in diabetes. Two options are correct. Which type of nephropathy take place in diabetic mellitus? You all know two types are there. Both take place in diabetes. One is diffuse, one is nodular. Let me modify the question. Right? यहाँ पे तो दोनों सही हैं. I know. But you cannot mark two questions. Now, if it is a PGI exam, it's good to mark two questions. But in other exams, only one option is correct. So if I ask more common, go with diffuse. If I ask more specific, go with C, right? Go with nodular. So depending what is asked in the question, go with that, right? So C and D both are correct here. But if I consider the specific one, अब कुछ नहीं दिया है, अगर same to same dipto question is coming in your exam right now, what you will go? You cannot stand up, raise your hand, the question is wrong, change it. You cannot do that, right? So you have to tick one of the option. You have to tick one of the option. So go with nodular because it is at least specific one now. The diffuse one is very common. Diabetes में specific nodular है. So go with C. Go with C in that scenario. If C is not given, go with D, right? So however, both occur, diffuse and nodular, but nodular one is pathogmatic feature. Go with the if you are going to with one, go with the pathogmatic, right? This is also correct, right? So अगर दोनों आ ही गए option में, तो क्या करोगे? Most common पूछा, तो of course everyone will mark diffuse. Most specific पूछा, तो of course everyone will mark nodular. लेकिन कुछ नहीं, ऐसा का ऐसा question आ गया, तो क्या करोगे? What you will do? So go with B followed by, go with C followed by B. You got my point? That is the thing. That is the thing. So shall I continue? Yes. This is the next question in front of you. The characteristic feature of the kidney in the diabetes mellitus. I'm asking characteristic, not common. So I guess till now you understand the meaning of the common and characteristic. Characteristic one is the specific one. The four options are in front of you. Is it nodular sclerosis? Is it fibrin cap? Is it papillary necrosis? Is it diffuse glomerulosclerosis? What you will say? Yes, Anu, Kishore, Sufi. Yes, Sufi, you are right. What about others? So characteristic feature, I'm asking the characteristic. By characteristic, I mean pathogmatic feature. I mean specific feature. So specific feature is nodular. It is not specific. It is not common. It is nodular. Instead of characteristic, if I ask common feature of kidney, characteristic word हटा के मैं common word लगा दूँ, तो answer will become G. Right? So this is how questions can be changed. Here the answer is A because characteristic is asked. Now someone is having such a deep knowledge, then only you can attempt these questions easily, smoothly. Otherwise, you will always get confused. Agar you are doing the rectification from the previous year question papers, you will get confused कि answer nodular है, कि answer diffuse है. So your concept should be strong. तो कुछ भी क्वेश्चन आ जाए डरने की जरूरत नहीं है, यू कैन क्रैक इट, राइट? सो नॉलेज इज द किंग, राइट? तुम्हें नॉलेज, कॉन्सेप्ट होना चाहिए, नॉट ओनली ऑफ पैथोलॉजी वन सब्जेक्ट, आई एम टॉकिंग अबाउट ऑल 19 सब्जेक्ट्स, all 19 subjects का all concepts should be fit in your mind, so that any question coming in your exam you are not afraid, you can crack it, whether it is a repeat question, whether it is a new question, whether it is a tricky question, whether it is a clinical oriented question, image based question, you can crack it all if you have the concept, right? Anyways, most specific, again the same question, I'm asking specific histological lesion in diabetes. So in other, the words are different, but the concept is same. I'm asking the characteristic feature, I'm asking the pathognomonic feature, I'm asking the specific feature. So answer is same now, answer is nodular. So we got it that nodular one is the characteristic feature, it is the specific feature, it is the pathognomonic feature, right? It is the most important feature in diabetes, right? Yes, so correct answer here will be D. Here, correct answer here will be D. You got my point. Occlusion of the glomeruli with fibrin cap. This occurs in diffused one. Fibrin cap diffuse में होती है, right? इसमें नहीं होती है. Correct answer here is D. So from the secondary, I started teaching you secondary glomerulonephritis today. The primary were done yesterday. The 9 primary glomerulonephritis we done in a beautiful comparative manner yesterday. Today I have started secondary glomerulonephritis. From the secondary, one is done diabetes. So in the secondary, first I taught you is diabetes. Second, I am teaching you is lupus nephritis. Let me start lupus nephritis. So why these are known as secondary? The main disease is something else. In diabetes, the main disease was diabetes and kidney was involving secondarily, right? Here the main disease is SLE and the kidney is involved secondarily. So in secondary, I am going to teach you only 2, right? So let me finish SLE and so secondary will be done. These are not very important at your point. You cannot cover all secondary, right? Now after that I will come on the hereditary. So first in the secondary, let me come